Tuberculosis is a socially significant disease caused by human and bovine types of tuberculosis mycobacteria. The source of infection is a sick person who, when coughing, sneezing, or talking, releases tiny droplets of so-called bacterial aerosol that contain tuberculosis mycobacteria. And these tiny droplets can remain in the environment for quite a long time if they are not exposed to direct sunlight. However, once they land on surfaces, due to the phenomenon of adhesion, that is, the attachment of the microbe to the surface, they can no longer serve as a source of infection. Thus, tuberculosis is transmitted only by airborne droplets. That is, when the person is near a source of bacilli emission, that is a sick person, they are at risk of becoming infected. The contact must be sufficiently prolonged in order for there to be a risk of falling ill. As a rule, this means at least 8 hours must pass. Therefore, the risk of infection in an elevator or on public transport is practically minimal. The risk of such infection is close to zero. Similarly, the risk is almost zero when staying in a room that a tuberculosis patient has just left. Bacilli carriers are especially dangerous for their family members and colleagues with whom they spend a lot of time. These people are in the risk group. These are the so-called family and occupational contacts. We divide tuberculosis into extrapulmonary, which affects a specific organ or system, such as bone tuberculosis, kidney tuberculosis, joint tuberculosis, or eye tuberculosis, and pulmonary tuberculosis. Pulmonary tuberculosis is further divided into several subtypes, or rather several forms depending on the extent of lung involvement. Focal tuberculosis is a pinpoint lesion within one or two segments of the lung. In other words, this is a mild form of tuberculosis. It usually occurs in people who were diagnosed early, sought medical attention in time, and acted promptly. This form, as a rule, is not accompanied by bacilli excretion, and such a person is not epidemiologically dangerous. That is, he cannot infect anyone. The next form of tuberculosis is infiltrative pulmonary tuberculosis. Here, as a rule, a larger area is affected, and the lesion is not pinpoint. For example, an entire lobe of the lung or several segments may be involved. The alveoli of the lung are filled with inflammatory infiltration, against which a portion of the lung may begin to break down. This is the so-called destruction, meaning a cavity of decay. Of course, this form is already less favorable, and quite often, approximately in 60% of cases, it is accompanied by bacilli shedding. That is, this person may already be able to infect those around them and poses an epidemic risk to others. There is also another form of tuberculosis called disseminated pulmonary tuberculosis. This is a widespread lesion affecting all organs and systems. Well, we detect lung lesions radiologically, but these same tuberculous foci in the disseminated form are also present in the liver, in the spleen, in other words, in all organs and systems. And for children, there is another very dangerous and relevant form, tuberculous meningitis. As a rule, it develops in unvaccinated children who have been in contact with a person shedding the bacteria. Tuberculous meningitis is an infection of the membranes of the brain. This is a severe form of the tuberculosis process, which unfortunately often leads to fatal outcomes. But now we have the ability to prevent the development of these forms through vaccination in young children and in adults through timely detection and treatment. In other words, we do not allow focal or infiltrative tuberculosis to progress to complicated forms, such as tuberculous meningitis.